Assalamualaikum everyone, welcome to my channel. Today we are going to discuss about the second type of the blunt force trauma, which is known as a bruise, and in some cases sometimes it is also known as a contusion. We'll talk about the difference between the bruise and the contusion because these terms are a little bit different like from each other in the definition and in this location. So let's talk about it. The bruise or contusion, it is actually an extravasation of the blood into the tissues due to a rupture of the blood vessels as a result of any trauma. Because the bruise is a blunt force trauma and blunt force trauma is a type of the mechanical injury. So here should be any mechanical or the physical injury or the trauma which tends to rupture the smaller blood vessels like capillaries, venules and arterioles, and after the rupture there is always a tendency of the blood to move out of the vessels and to accumulate into the extravascular spaces or within the tissues. So the two events must occur before the bruise formation. The first one is a rupture of the blood vessels and the second one is a leakage or the movement of the blood from the blood vessels and its accumulation into the tissues like to form a bruise formation or to form a contusion. So actually the blood vessels which undergo rupture and cause the bleeding or the hemorrhage within the tissues are usually capillaries, but they may be venules or the arterioles. And keep in mind one thing, that the bruise is a bleeding within the tissues like within the skin, in the dermis of the skin or within the subcutaneous tissue. So there is no any loss of the continuity, no any trauma or the injury to the surfaces like skin or the mucous membrane. The continuity of the skin and the continuity of the mucous membrane are maintained, though there is no any trauma to the skin or mucous membrane or to like any surface. So the surface remain intact. And bruise, normally it is considered like that bruise is a minor injury. It is not, it is a simple injury. It will not cause any major trauma. But in some cases when there is an extensive bleeding, bruise in these cases bruise is not a minor trauma, like in the cases of the bleeding within the liver, within the heart without any visible trauma to the chest wall, or bleeding in the internal organs. So in these cases death can occur and the bruise can be like major and the severe injury. So I would like to describe the differences between the bruise and the contusion. Like we can say bruise it is used to describe any visible external marks like in the form of a discoloration of the skin which are caused by the leakage of the blood into the skin or into the subcutaneous tissue. Because when there is any bleeding in the skin or within the subcutaneous tissue, there is always a discoloration of the skin, there is always the appearance of the blood on the surface. But in the case of the contusion, it is a term which is used to describe the bleeding or the hemorrhage within the tissues or within the body cavities, and if there is any bleeding occurs within the internal organs. So in most of cases there are no external or visible external marks or the discoloration of the skin. So the bruise and the contusion can be differentiated from each other on the basis of the appearance or of the blood on the surface or the discoloration of the skin in this particular area of the impact. And there's another word, hematoma. It is actually a palpable swelling or the collection of the blood under the skin, and like this collection of the blood, we can say that it has an accumulation of the fluid, and this can be expired by the help of the needle. And there's a word known as a petechia, Petechia. It is a word which is used when there are the small bruises which are about less than 2 mm in size. Here in this picture you can see there are the like small bruises. Here you can see on the cheeks of this like women has a small bruises like pinpoint bruises which are less than like 2 millimeter in the diameter. So these are the differences between the bruise and the contusion. Bruise word is used in the case of the bleeding in the skin and in the subcutaneous tissues, and the contusion word is used in the case of bleeding or hemorrhage within the body cavities or within the internal organs. The bruise is divided into the three types on the basis of the location. These are the intradermal bruise, subcutaneous bruise, and the deep bruises. And the most common type of the bruise and the most superficial bruise is intradermal bruise, which occurs in the dermis due to like rupture of the blood vessels, tiny or small blood vessels within the dermis of the skin, and the subcutaneous bruise which occurs within the subcutaneous tissue layer, and the deep bruise which takes place either in the muscles, eye, or within the internal organs of the body cavities. And there are some causes which like results in the bruise formation, like stick, kick, fist, stone, and the tire of the vehicle, and the belt or the bicycle chains. These all objects are like causes results in a bruise formation in the different conditions, in the different cases. And here in this picture you can see that there is a network of the arterioles, venules, and the capillaries, and this network is responsible for the bleeding within these like tissues or the intercellular spaces. Here in this picture you can clearly see that on the faces of these individuals, this is a picture 1, and in this picture 2 you can see there is a discoloration of the skin, and also in this case there is a discoloration of the skin on the cheeks and the nose of these individuals. But in this case there is a less bleeding has occurred, but in this case there is a more bruise formation, and these all are the types of the intradermal bruise. Also in this picture you can see the examples. There is a deep bruise, like more bleeding has occurred due to rupture of the small blood vessels within the muscles. Also here in this picture you can see the yellow area between in the center, and the periphery there is a like red area, and this bruise is in a healing process. The first type of the bruise is an intradermal bruise, and it is the most common and the most superficial type of the bleeding which occurs in most of the individuals, and it is caused by the rupture of the small or the tiny blood vessels within the dermis, and the dermis is present below the epidermis, so that's why for this reason this type of the bleeding is also known as a subepidermal bruise, and it is caused by the impact or the application of some penetrant objects on the body. And these bruises always take the shape or take the form of the object. For example, if the bicycle chain or the motor tire or any other instrument like the belt, when these objects are used on the body to cause the injury, either for the purpose of beating someone or for the purpose of killing someone, so after the impact the bruise always take the shape or the form of the instrument which was used to cause the injury. And there is an exception that in most of cases of bruises, it is not necessary for the bleeding to appear at the site of impact. It may gravitate due to it may migrate due to a gravitational shifting. But in the case of intradermal bruise, the bruise or the bleeding is always present exactly the same place where the object has been applied to the body. So it's the case in the case of intradermal bruise. Here in this picture you can see the two examples showing the intradermal bruise formation. Like in this case you can see there are some patterns on the cheek of this individual, and these are cast like these patterns or designs are on the sole of the shoe. So when this person is kicked by a shoe sole, So the patterns are designs which were on the sole of the shoes of the individual. So these are drawn here. So we can say that it is a case of the intradermal bruise. Also here in this picture you can see that this part of the belt has been used to cause injury, and the bruise has taken the shape of this part of the belt. So we can identify from the shape of the bruise that like either it is an intradermal bruise or it is a subcutaneous bruise. And here's a second type of the bleeding, which is known as a subcutaneous bruise, and it occurs with the rupture of the small blood vessels within the subcutaneous layer of the loose connective tissue or adipose tissues. Because the subcutaneous layer, it is actually a layer of the adipose tissues or loose connective tissues which is present below the dermis. So for this reason it is also known as a hypodermis. Here you can see in this picture there is a topmost layer of the skin is the epidermis, then below this there is a dermis, then below the dermis there is a layer of the loose connective tissues. You can see these like small and the large lobules showing the adipose cells or adipose tissues, and the bleeding in this case is also known as a subcutaneous bruise. There are some characteristic features or the points which are useful for identifying the subcutaneous bruise, like the edges or the margins of the subcutaneous bleeding are always blurred. These are not defined and clear, and in some cases of the subcutaneous bruise, the bruises or the bleeding are raised in the center above the skin due to infiltration of the blood in the subcutaneous tissue. And the subcutaneous bruise always appears just after the injury. It will not take the hours or even 2 or more days for its appearance in the form of discoloration of the skin, like in the case of the deep bruise where the this like bruise appearance takes the hours or even 2 or more days for the appearance on the skin. And subcutaneous bruise may vary in size from the pinhead size, or these may be present in the form of a large swellings, and these large swellings which are palpable and raised above the skin are known as a hematoma. So hematoma may be a subcutaneous bruise, or bruises may be present in the small sizes like in the form of petechial hemorrhages, as we have discussed earlier. Here in this picture you can see these are the examples of the subcutaneous bruise. So let's come to the last and the third type of the bruise or the bleeding is a deep bruise. The bleeding which occurs due to rupture of the blood vessels within the tissues deeper to the subcutaneous tissues or subcutaneous layer of the adipose tissue, like within the muscles or within the body cavities, bleeding within the organs in the lungs, liver, heart, in the stomach. And so on this basis the deep bruises may be muscular bruises, or these may be periosteal bruises in the case of the bleeding which occurs on the skin in the on the periosteal like bony prominences, and the bruises within the viscera. And also the deep bruise has some characteristic points, like these are usually blurred and indistinct because these are deep, means the bleeding are deep within the organs, within the viscera or body cavities. So these are usually in most of cases are not present externally as visible marks in the form of the discoloration of the skin. If they are present, if these bruises are visible to the skin, so these are blurred and indistinct, not defined and clear, and bleeding in the case of the deep bruises appears on the skin in the few hours or in the 2 or more days after the injury or the trauma. And the hemorrhage which occurs within the internal organs or within the deep tissues are not visible externally at all, because bleeding within the internal, as we have discussed earlier, that bleeding in the deep bruise is like it is deep, it is not superficial. So the discoloration of skin always occurs in the case of the superficial bruises like in the subcutaneous or the intradermal bruise, and in the severe and the extensive bleeding within the tissue there is no any discoloration of the skin. So in these cases we give the incision to find out the actual site of the bleeding, um, like in the cases of the sacral and in the sides, sacral and the iliac prominences are in the spine and the shoulder blades. And as we have discussed earlier, there's a difference between the contusion and bruise. So in the case of the bleeding within the internal organs or within the like muscles, we use the word like deep contusion instead of the deep bruise or simply the contusion. There are the some factors which modify or influence the appearance and the development of the bruise. These are the site of the injury, vascularity of the injured part, age, sex, and the color of the skin, and the nutritional are the natural disorders. And the last and the most important one is the gravitational shifting of the blood. So the first factor is the site of the injury. There are the two most important sites which are considered when we talk about the bruise. These are the site over the bones, and the bleeding are the bruising within the loose connective tissues. The bruise formation over the bones is marked and it is not noticeable, and it results in a pain, swelling, and the like inflammation. And in the case of the subcutaneous tissue, it is much easier for the blood to escape and to accumulate into the loose and the legs connective tissue, like in the case of the subcutaneous bruise, where they are the adipose tissues. So it is much easier for the blood to escape and to cause the bruising. And also it is much easier for the blood vessel to rupture easily in the area where the skin is delicate and thin as in the compare of the thick skin. So where there is a thin skin, so there will be more bleeding and the bruising as compared to a thick skin. So the bruising is most common in the legs tissues, like around the eyes, in the face, around the genitalia, like around the vagina and the scrotum. And the bleeding or the bruise formation is rare in the scalp, in the sole of the foot, in the palm of the hand, because in these areas, first of all, there is a less subcutaneous tissue, means the tissues are the like means the tissues are tightly packed and supported, and also in these areas the skin is not delicate and thin, skin is thick, and that's why for this reason bruising is less commonly seen in these areas as compared to in the case of the eyes and the face and the genitalia. And the second factor is a vascularity. If there are the more blood vessels in injured area, there will be a more bleeding and the bruise formation as compared to the area where there is a less bleeding. There will be a less bruise formation, means the extent of the bruising will be less as in the case of the highly vascular areas. And the third factor is the age. Age also influence the appearance of the bruise. For example, in the children and in the aged individuals, there will be more bleeding and the bruising, because in these both cases, in the children and the elder people, there's a lot of subcutaneous tissue, and also the skin is delicate and thick in the children and in the aged individuals. And for this reason these tend to bruise more easily as compared to younger ones. Also there's a reason in the old elder peoples, like with passing age there is a decreased synthesis of the collagen, loss of the elasticity, and due to a decreased collagen the walls of the blood vessels become weak and the fragile, because the collagen gives a strength to the blood vessels, and in the absence of collagen vessels become fragile and easy to rupture even with a mild trauma or the injury. So this is a factor, and after this there is a sex which also acts as a factor to modify the appearance of the bruise. Like in the women, there's a lot of subcutaneous tissue or the adipose tissue as compared to men, so the women tend to bruise more easily as compared to the men. And also there's another reason, in the women the skin is thin as compared to men, where the skin is thick and is not delicate, so the bruising is most commonly seen in the women as compared to the males. And after this, there are the nutritional diseases, natural like disorders, bleeding disorders. The individuals with bleeding disorders are prone to bleed more easily as compared to individuals with a normal one. For example, the bleeding disorders are the scurvy, hemophilia, and the leukemia. So in these cases, like bruising occurs more easily. For example, in the scurvy, there is a deficiency of the vitamin C. Due to vitamin C deficiency, uh, like there is a decreased synthesis of the collagen, and due to a decreased collagen synthesis, the walls of the blood vessels become fragile and weak and easy to rupture with a minor with a minor trauma. And hemophilia, in the case of the hemophilia, there's a deficiency of the some clotting or the coagulation factors. So when the bleeding occurs with a trauma to the vessels, and it is much difficult for the blood to stop it, is in the case of the presence of the clotting factors, where the bleeding stops within a minutes to seconds after the rupture to the vessels. So here in the hemophilia, the bleeding time is increased, prothrombin time is increased, we can say that, and it is much difficult to stop it. So it can result in a more and more bleeding within the tissue and the bruise formation. Also, the individuals which are consuming alcohol or with a low physique are more prone to bruise easily as compared to a healthy ones. And after this, there is a factor which is the color of the skin. Color of the skin also influence the appearance of the bruise. Here you can see in this picture there are the two examples. In this case, there's a skin color is dark, and in this case skin color is light in the fair. So it is much more difficult to observe the bruise in the case of the dark skin persons, but it is much easier to observe the appearance of the bruise or the presence of the bruise in the fair skin individual. So the skin coloration can affect the appearance of the bruise. And the last factor is gravitational shifting of the blood. It is of most important that we should know. It is not it is not always correct for means important or necessary for the bruise to appear exactly at the site of the impact. Sometimes in some types of the bruise, blood may migrate, it may gravitate under the gravitational force other than to another place other than the site of the impact. Like in this picture you can see there is a bruising behind the ear, which is known as a retroauricular bruising, also known as a battle sign. It is not due to a direct impact in this place, but it is due to a like rupture. It is due to a fracture of the base of the skull due to any trauma or blow to the vertex or the cranium. And in these cases there is always accumulation of the blood behind the ear, so blood migrates and like under the gravity and accumulate here in the fracture of the base of the skull or in the fracture to the vertex of the skull. And also here in this picture you can see the appearance of the bruise or bleeding around the eye, which is known as a periorbital hematoma, or the spectacle hematoma, which causes the black eye. And it is not due to a direct impact or the trauma in this area, but it is due to like any trauma to the forehead due to a fracture of the vertex of the like skull. It is due to a fracture orbital roof. So in these cases the blood accumulate here in this area. And also due to a reason because around the eyes there's a lot of the subcutaneous fat or the legs tissues, so it is much easier for the blood to accumulate here in this area. And also in other cases, like in the case of the fracture of the femur, there's always appearance of the bruise at the lower part of thigh, and in the case of the trauma or injury to the calf muscle, there is a bruising around the ankle. So these all are the cases, are the factors which modify, which influence the appearance of the bruise formation. And there are some types of the bruise, like true bruise and the artificial bruising. Artificial bruise, it is also known as a self-inflicted. It is also known as a pseudo or the false bruise. So the first difference is of the instrument or the cause, means the true bruise is caused by the physical violence as we have discussed, but the artificial bruising, it is caused by an individual self. In many conditions, like in those individuals which are like mental ill, are individuals with in a stressful condition, in anxiety, in a depression, can cause artificial bruising to themselves. And artificial bruising, it is caused by this application of the some irritant substances. These are actually the toxic plant products which are when applied on the skin can cause the irritation and the appearance of the bruise. So these may be a root of the plumbago or marking nut juices or any other plant like toxic plant products which results in artificial bruising. True bruising can occur anywhere in the body, but artificial bruising is caused by the individual itself, so it is caused occur on the accessible areas where we can reach cause the or apply the irritant substance. True bruise is round in shape, but the artificial bruising is irregular. Its margins are irregular, but most of cases of true bruise, its shape, its appearance is round. And the most important difference, true bruise, it is due to extravasation of the blood. It is due to a movement of the blood out of the vessels and its accumulation into the tissues. So it always contains infiltrated blood. But artificial bruise, it is due to application of some irritant substances. So it contains acidic materials or acidic serum. There is no any blood in the case of the artificial bruising. And also the swelling occurs at the site of the impact. If it is present at the site of the impact in the case of true bruise. But in the artificial bruising, swelling occurs in the surrounding areas. It is not present at the site of the impact. Itching is absent in the case of the true bruise, but it is present in the case of artificial bruising. In the case of the true bruise, there are the color changes. Like initially, color of the bruise is red, and after this there is a blue, purple, green, yellow, and after this it will disappear. But in the case of the artificial bruising, there is no any color changes. Like color is uniform and it is like dark brown color. So we can differentiate that artificial bruising from the true bruise in the sense of the color. Also, there are some other types like antemortem bruise or the postmortem bruise. Postmortem bruising, it is also known as a postmortem lividity or postmortem hypostasis. In antemortem bruising, which is simply known as a bruise, means bleeding occurs before the death. Postmortem bruise, it is small in size as compared to the force applied, because in the case of antemortem bruise we have studied that there is a direct relationship between the violence and between the size of the bruise. If there is a more force applied, then there will be more bleeding, but in the case of the postmortem bruise it is not true. And the postmortem lividity or the hypostasis, it is It is sharp, well-defined margins. Means margins of the postmortem bruising are clear, defined. These are not blurred. But in the case of the antemortem bruising, the margins are the indistinct. These are blurred, not defined and clear. In the postmortem bruise, there is no any swelling, but in the antemortem bruising, the swelling is present, like swelling of tissues. And the most important difference in the postmortem and antemortem bruise, that in the postmortem bruise, there is a no any extravasation of the blood. Like after the death, there is always a cessation of the circulation and the accumulation or the stasis of the blood within the tissues, or like within the blood vessels, not within the tissues. So, under the gravitational action, blood always moves and accumulates into the lower parts of the body, and as a result of accumulation of this blood, there is appearance of the pink or the red color on the skin, and it results in a bruise formation, which is known as the postmortem lividity or the postmortem hypostasis. Means it is due to stasis of the blood, not due to extravasation of the blood in its accumulation into the tissues. But yeah, in the antemortem bruise, there is extravasation of the blood. So in some doubtful cases, we do a microscopic examination to distinguish the antemortem bruising from the postmortem bruising. If there is any infiltration of the blood within the tissue, then it is a case of the antemortem bruise, and if there is no any infiltration of the blood within the tissue, then it is a like case of the postmortem bruising. And in the postmortem bruise, there are no any color changes occur. In the antemortem bruise, the color changes occur. We'll discuss about this in later. Like this, the first initially it is red, then blue, purple, green, then yellow. The postmortem bruising occurs on the bony prominences, but antemortem bruising is like it is present anywhere in the body, in any part on the bony prominences, into the tissues, subcutaneous or the legs tissues, within the deep tissues. And there are the terms bruise and lividity. These are same. Bruise means antemortem bruising, lividity means like postmortem lividity or the postmortem hypostasis. So there are the like some differences. Situation: bruise can occur in the epidermis or within the subcutaneous tissue or within the deep tissues. In lividity, it is due to a accumulation of the blood within the capillaries, and this stasis results in a discoloration of the skin, which is known as a lividity, means the bruising after the death. And there may be abrasion in the case of the bruise, but in the case of lividity, there is no abrasion on the cuticle. So the site, the bruising which occurs over the site of the injury, and lividity it mostly occur on the like bony prominences, but the bruising occurs anywhere in the body. The edges of the bruise are not sharply defined as discussed earlier, but in the case of lividity, the margins or the edges are defined, clear, not blurred. Appearance: the bruise, or we can say that the bleeding which occurs before the death, it is raised in most of the cases above the skin in the form of the hematoma. But in the case of lividity, the like bruise is not raised above the skin. It is like flat. Color: there are the color changes in the case of the antemortem bruise, but in the case of the lividity, there are no any changes in the color. It is like uniform color. It is, for example, reddish or pink in color, then after a few days it will disappear and skin recovers its normal color. So there are the color changes. Means after the appearance of the bruise, it undergoes a healing process by a series of the color changes. It is due to a hemolysis of the red blood cells and the breakdown of the hemoglobin into different pigments. Initially, when the bruise appears, it is fresh, like fresh bruise is red in color. And also it is due to presence of red blood cells in the hemoglobin, but on the first day there is a deoxygenation of the hemoglobin because initially the hemoglobin is oxygenated and there is a presence of the red blood cells, so the bruise is red in color. Then on the first day the bruise turns to a blue due to a deoxygenation of the hemoglobin. Then after this, within 2 to 4 days, there is a hemolysis of the red blood cells and the breakdown of the hemoglobin into the different pigments. So within the 2 to 4 days or on the fourth day, the bruise changes from a blue color to a dark blue or the purple color, and it is due to a breakdown of a hemoglobin into a pigment known as a hemocyanin. Hemocyanin, it is actually iron containing pigment and it is of dark blue or brown in color, so it gives a like color to the bruise, which is also the dark blue, brown, and in some cases it is purple. And within 5 to 7 days, means on the 7th day, the color of the bruise is green and it is due to accumulation of the hematoidin. It is also a pigment which is derived from the hemoglobin, and this is a iron free pigment and it is green in color, so it gives the green color to the bruise. Then after this there is a appearance of the yellow color on this within 7 to 10 days due to accumulation of the bilirubin. Then within 12 15 days or 14 days, within 2 weeks, the skin regains its normal color. Here in this picture you can see there are the 4 stages of the color changes of the bruise. The initially it is red in color, then within 5 to 7 days it turns to purple or dark brown due to a hemocyanin. Then it turns to green within the 10 days due to accumulation of the hematoidin pigment. Then after this it look like a yellow color. Then after this appearance the skin regains its normal color. But there is an exception in the case of a subconjunctival hemorrhage. Subconjunctival hemorrhage, there in this there is it is also bruising, but there is a bleeding due to a rupture of the conjunctival blood vessels and accumulation of the blood into the sclera, which is known as the white of the eye. It may appear in mild cases in the form of spots, but in the severe cases there is a large amount of accumulation of the blood within the sclera due to rupture of the small blood vessels within the conjunctiva. But there is a little difference in the color changes. There is no any appearance of the blue color due to reason the hemoglobin is always kept oxygenated by the air every time, because there is a direct supply of oxygen to the eyes, so there will be no any appearance of the blue color. Initially the color is red, then after this it turns to green, yellow, and it will disappear. So there is an exception in the case of subconjunctival hemorrhage, but in most of the cases the color changes are initially red, then after this there is a blue, then purple, then after this there is a green, yellow, and the normal skin color. And the last thing about the bruise is the most important, the medico-legal importance of the bruise. Bruise is important medico-legally. From the appearance of the bruise we can identify the object which is used to cause the injury. For example, we can identify the instrument which is used to cause the bruise formation. From the appearance of the bruising, we can identify the degree of the violence, the cause of the injury, time of the injury, and the possibility of the infections. For example, in the case of the intradermal bruise, the patent objects are applied on the body to cause the injury, so we can identify the object. For example, in the case of the bicycle chain and in the case of belt, which is used to resolve the bruise formation, so the bruise takes the shape of the chain. In the intradermal bruising, bruise can take the shape of the part of the belt which is used to kill someone or beat someone. to cause the bruising. So in this case we can identify the instrument which is used to cause the bruising. And the second thing, second point is a degree of the violence. If there is more bruising, then we can say that the more forces applied to cause it. If there will be less bruising or the bleeding, then the lesser forces applied to result it. Uh, uh, Actually, bruising is a simple injury, but in the case of the deep bruising, where there is no any discoloration of the skin, there is no any extra injury to the body, but there is a bleeding with the inter organs, so it will be fatal. It can result in a death. For example, in the case of a bleeding within the lungs or within the heart, these are serious conditions even without any visible injury to the chest wall, so it will be a fatal. But in normal sense, the bruising in the case of intradermal bruising in the subcutaneous, it is not too much fatal as in the case of a deep bruising. We can identify the cause of the injury. In this case, you can see there is a bruising on the neck. So we can identify, can observe, estimate that it may be due to a throttling, or it may be due to a manual strangulation. Manual strangulation, it is a condition or process in which the individual try to strangle someone by using the fingers or by using the other hand or other extremities, or usually the people use the pillow. It is another condition like suffocation, but in the case of the throttling, someone uses usually its hands to strangle someone. And in the strangling, or in the case of the strangulation, it results in a fracture to the hyoid bone or any trauma to the larynx, so it can lead to a death. Also, there is a process known as smothering, suffocating someone. In this, the individual uses a pillow or any other object to put it on the face or the nose or the mouth of the individual to suffocate someone, and it can result in a bruise formation. So if there's any bruising around the nose, around the mouth, so we can estimate the any other object or the pillow has been used to cause the bruising or to cause the death of any individual. So in this way we can identify the cause of the injury. So the bruise can also help to identify the time of the injury. For example, the overall time of the bruising is about 2 weeks or the 14 or 15 days. So if, for example, we are going to observe the bruise and at this time it is yellow in color, so we can say that it has been 7 to 10 days for the bruise to appear. Or if its color is purple, so we can say that it has been 5 to 7 days for the bruise to appear. So we can identify the bruise from its appearance. We can identify the time of the injury or the time of the bruise. And there may be a possibility of the infection, but it is a rare condition. In the case of the bruising, in the abrasions, the possibility of infection is rare, but in the laceration, there is a little bit possibility of the infection to occur. So it's all about the bruise.